Welcome to the Rx Minute, brought to you by Rx Benefits. In this segment, we'll discuss diabetes risk factors and complications. Risk factors for diabetes depend on the type of diabetes. For type 1 diabetes, the exact cause is unknown, although factors that may signal an increased risk include family history. Your risk increases if a parent or sibling has type 1 diabetes. Environmental factors. Circumstances such as exposure to a viral illness likely play some role in type 1 diabetes. The presence of damaging immune system cells or autoantibodies. If you have these autoantibodies, you have an increased risk of developing type 1 diabetes. But not everyone who has these autoantibodies develops diabetes. Geography. Certain countries, such as Finland and Sweden, have higher rates of type 1 diabetes. For type 2 diabetes, although researchers don't fully understand why some people develop prediabetes and type 2 diabetes and others don't, it's clear that certain factors increase your risk. These factors include weight. The more fatty tissue you have, the more resistant your cells become to insulin. Inactivity. The less active you are, the greater your risk. Family history. Your risk increases if a parent or sibling has type 2 diabetes. Race. Although it's unclear why, people of certain races are at higher risk. Age. Your risk increases as you get older. High blood pressure. Having high blood pressure is linked to an increased risk of type 2 diabetes. Abnormal cholesterol and triglyceride levels. If you have low levels of HDL, or good cholesterol, your risk of type 2 diabetes is higher. Additionally, if you have high levels of triglycerides, you also have an increased risk of type 2 diabetes. The longer you have diabetes, and the less controlled your blood sugar, the higher the risk of complications. Eventually, diabetes complications may be disabling or even life-threatening. Possible complications include cardiovascular disease, nerve damage, kidney damage, eye damage, foot damage, skin conditions, hearing impairment, Alzheimer's disease, and depression. We hope you found this information helpful. Thank you for watching this edition of the Rx Minute, brought to you by Rx Benefits.